All right, welcome everybody. Tuesday night workshop on Monarch Family Chiropractic's technique. I'm Dr. Kristen. Thank you for joining us tonight. It's awesome to have you all here in the office and out in our online community in Zoom. So we're going to jump right in and talk about this. This is a topic that's new this year, or I guess I'd say in the last year, and covered about 7-8 months ago. And we want to just touch base on this at least once or twice a year so that newcomers and those new to chiropractic, or those of you might be watching this and it's you've been adjusted different places, you've been adjusted in different ways, you've been adjusted by different people, and sometimes it's nice to clear up the similarities and the differences in adjusting and in practices, and why we do what we do, and what makes us maybe different and unique than other practices, which we get told a lot. And it can be some of our technique, and it can just be the style in which we practice and the way in which we educate. And that is a big part of our practice. You'll hear Dr. Mike and I say so many times, hopefully over and over, to where that's in your psyche, in your brain, that our education piece is much more important in many ways than our actual adjustment. Because if there's not information you know and that you're experiencing and that you're sharing and that you're incorporating to your self-care, then many things, any technique or not, can be described as, a failed technique or didn't work or wasn't for me. And many times it's just the components putting it together have to be the right fit, right? The right fit for the puzzle. And so let's dive in. Oh, it's going to do this in 1 second. There we go. Now it's working. So we like to start off, and we've done other workshops around this, but we really like to talk about chiropractic philosophy as well as we get into our technique. And this again is alluding to what I was talking about education. So much of it is, if you don't understand how your body works, how your brain and nervous system are in control of all cell tissues, organs, muscles, glands, every part and piece of your body, to have it signal the way it's supposed to, that the disconnect of that doesn't allow our bodies to experience its fullest expression. And so when we talk about the difference of salutogenesis as opposed to an allopathic model or pathogenesis, and it's really looking at how are we defining health? What does that mean to us? Salutogenesis means the birth of health, and a lot of things that we look at in the way in which our Western medicine and medical model operate is coming from a state of more disease or disease rather than health or preventative measures of health and what it is we're doing to support health. But the World Health Organization definition is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So I think that's very true statement, and not necessarily what we practice, I feel like, in our day and age. Our exam is really, about evaluating health. And so what makes it different is we're looking at multiple components of what leads to and impacts our health. And it's that function of the brain and the spine or the nervous system. If that gets overlooked, then again, we can target any organ system pathway we want to, but is it getting to the root of the problem? So we could give a gazillion examples, but I think about the things we do to evaluate that. And again, our philosophy and what makes us different is, if we don't find subluxation present and that disruption in what impacts our health and our function, then you may not be in the right place. That might not be what we can help with. And how ways in which we develop and evaluate that has to be your motion and how well do you move, because the body's designed to be in motion, not stagnant, not sitting, not being inactive. That is what ages us. That is what degenerates our spine. So we look at many things. It's how we move. It's, yes, some things of how we feel. We want to note maybe markers of where you're at, but that's not what drives any of this. You can have subluxation and all kinds of disease functions and have no pain. And it isn't usually until we're at a 60, 70, 80th, 90th percentile of occlusion of an artery or stress upon something that we actually feel pain from it. So it's a very small indicator of any kind of problem at all is actually pain. And we talk about that in many other workshops, but the components of what we have to figure out when there isn't necessarily pain is, where could there be a disconnect in the system between that signal of brain to body, so that we're finding where the root cause is. You may feel pain in your knee and it's coming from your hip and your low back, or coming from something higher up. So ways in which we evaluate and what makes us different is that we're checking your motion, we're checking through what you can and can't do. We're looking at what your baselines are. We're looking at what strength is, right? What is muscle strength? What is nerve strength? What kind of signals coming out of the body to all those parts and pieces? Posture is a huge one, right? It's the window to our spine. And if you're listening to this, you know that's one of the answers to the quiz questions that we've had this last month, is that it's really a way to look into how are we holding ourselves, carrying ourselves, which will create either good function or poor function. And enough of that over time changes and ages the health of our spine. So how is your spine aging? One way we can look at that, besides its motion and mobility, is really through x-ray. That's a component of why we take films here and why we've, invested in having such state-of-the-art equipment in the office, is because if we don't know how long something's been there, and that's usually what we're telling by the x-ray, is the aging in the spine, and how long that's been degenerating or changing or creating stress upon the structures and the organ systems and all of those other components, then we don't know how long it might take to be better, to get better, or to change or correct the patterns, let alone the structural movement. And so that also will allow us to sometimes see how your brain's adapting to stress. So meaning when we do the scans so we'll do the scan upon your spine, your entire spine, for thermal imaging, so depth and deepest layer of our nervous system, organs and glands and what they're saying, and then the muscular system, right? You hear us talk about, we do a surface EMG. An electromusculograph is really showing how are those postural muscles that are holding your structure in place from top of the head to the tailbone. How are those muscles activating and working as they're trying to hold your posture and hold you in place all day long through all your life and your movements? And what kind of signals output is there? Is it an active, normal, healthy muscle signal? Is it an underactive signal that's weakened or just fatigued because it's so tired of doing what you've asked it to do for as many days or years or months, that you've been doing it? And or is it putting out an overactive amount of energy and muscle activity, where you are overriding so many other areas by activating or overactivating these posture muscles to do more than they're designed and supposed to do? All of those things that can create stress upon the system. And again, can lead to pain. That's one thing it can lead to, but it definitely leads to all these other components of dis-ease and aging. And so with education and workshops, that is a component that I feel like about 80 to 90% of our profession never does. And we find it vital for you to know things like this and come together to learn what's happening outside of your adjustment, what's happening outside in your world, what happens outside of your, 10, 15-minute visit in the office, whether that's weekly, whether that's a few times a week, whether that's less than that. There are components that our life is putting upon us that we have to combat and that for them to not win, we have to be doing outside things, right? So it's the term you hear us call self-care. And that's a component of, I always use that example of the intensity of your life tends to dictate the frequency of your care or your self-care, how much you need to be doing based on what's happened in your life and how much you're stressed upon your body and your structure that you're giving it and how much you're putting in or putting on it, right? So techniques and specialties are what it is we do. Really, evaluating to detect and correct subluxation. So we've got to know where and when to adjust. And looking at how we do that is all that evaluation process that I just described. And so when we're finding the subluxations, when we're finding those areas that don't move correctly, that there's stress upon it in the nervous system scans that we do, that the x-rays don't look like the curves are where they should be, right, to support a very supportive, mobile structure, then that we know that leads to where subluxations are present. And that is where that movement of the spine is just not how it needs to be, or it's putting stress upon organ systems, glands. So there's multiple ways to be adjusted. And I think in short, it's fair to say and that it all works. It's just with finding what's right for you and what's right for your nervous system and the evaluation of that. So there's techniques that Doc and I do between our I think we've determined 23 years combined experience and time as chiropractors together collectively. And even just stepping back at our own care, Doc's a chiropractic kid. Her dad's a chiropractor. So she's had adjustments since day one of life. I've had adjustments since I was about 6, I think, 5 or 6, 6 or 7, 6, I think. So I just remember phase of my life, exactly what age I was. I think that's what it was. And so we've had multiple with Doc as eventually as she, was out of the home in her home area and where her dad was practicing. We've received, adjustments from many different chiropractors over our life. For her, more so maybe in adult life. For me, on and off throughout my whole childhood, as our chiropractors changed, retired, moved, we moved, needed something different. And I've received really great care, I feel like, under all of them, but very different. And so I think it's fair to say that there's really multiple ways to remove a subluxation. And as long as we are detecting to correct them the right way and knowing when to adjust and where to adjust, then the technique, to me, doesn't really matter. And it's really about marrying and what's good for the patient and what that patient needs with sometimes the technique or the force that needs to be delivered. And so low force instruments and the things that we have listed there, where you're having either sustained pressure or it can be a quick impulse, it can be a longer impulse, it can be more pulsating and repetitive movement. The sacral blocks that sometimes you see or you may have experienced laying on is a component that does things slower over time with how it's removing the subluxation and allowing your body to come into more ease versus the dis-ease that it's in that position. So the activator is that handheld tool. Some of the different techniques that's specific more to Doc is the Corin specific technique, and Logan Basic is something we both use. It's very light force and touch. So how I describe this, and again, it's nice to, I think, have a different way of hearing it than maybe how Doc described it when she did the workshop a few months ago, is that, the different instruments we use and the different hand movements we do are all to deliver the same type of input. It's just in a different way. It may be slower, it may be faster. And so there's a different amplitude versus force. And that just is dependent upon what the body's needing. So I like to describe it in a way of something I learned in school. And as I was graduating, working with some amazing docs in the field that do tonal work. And it's more about matching kind of, in a sense, the tone or where that patient's at. So, and that really can change from adjusting a brand new baby to adjusting somebody who's 40, 50, 60 to adjusting some of our 80-year-olds. Everybody's had a different amount of input into their structure, and it responds in different ways. And so a lot of the techniques that we've listed, Doc and I have spent many decades perfecting and doing and being trained on and doing additional training on and continually doing our education classes every year on some of these things, because it's the best way to have multiple tools in the toolbox, right? To assess things differently and say, okay, someone's responding better with this technique than this. So, we're not married. There's no ego around what the technique is. It's just that we're picking the one that works best for you. And you may have had, if you've had adjustments for over many years in your life, like Doc and I have, and that many of you have, that are sitting here, it's a matter of you may not have been adjusted the same way since you started getting adjusted. And that's good. Your system needs different input. Your system evolves and changes and is different than where it was when you started care. So those things change just really based on what your body is needing to us and how it's responding best. When there's a lot of tone in the system and there's a lot of tension, then the body doesn't, I find, release with faster motions or maybe a little bit more force in the motion. It responds to lighter touch, different tonal work where it's releasing pressure, maybe first at the ligament than it is at the actual joint or in the bone. But a ligament is what is attaching the bone to the muscle to the bone. So all of that, as we're a musculoskeletal system, has to come into play. So I feel like when there's lighter force and lighter of those techniques done, you're really lightening and lessening some of the intense tone. Or think about how tight a guitar string is when you tighten it, or when you're, tuning an instrument. Sometimes you'll hear me in the office say, "Oh, that feels like beef jerky. Oh, that feels like, a rope or rubber band." Because there's different tone to that. Like, we all kind of know what we mean when we talk about a a guitar string and something that's taut versus something that's a rubber band that has laxity and looseness to it, right? And so those are all different components that we can experience in our structure and in our frames and in our framework, that different approaches tackle that different and support those types of tonal feelings and movements, to I would say adjust and change and adapt the best. And so you may see that I do more motions with the table, or movements with the table. That's a specific Thompson technique that I learned in school. Motion palpation and Gonstead, the same, with it being a little bit more done manually by hand. Whether it's seated, whether it's laying down, whether it's on your side, whether it's on your back, all those motions are done assessing a certain position and motion. And the instruments is, we may be using more of our hands to determine where you're at. And then the instrument is acting like my hand in many ways and changing the vector or the position of a joint, or a tone upon that joint and muscle and vertebra. And so I think it's interesting. It's just nice to know that there's that kind of range within our practice. And I think that's great when you be, without even a background of not growing up in chiropractic, when you have experience of both of us having adjustments most of our life, then what feels different. What it feels like yourself to be adjusted, and to be adjusted in multiple different ways, and to be adjusted through different phases of life. So, how I was adjusted as a kid is not how I was adjusted when I was in my heaviest years of college or high school and playing sports and having different types of movements and injuries, as I am now when I was, pregnant, and versus how I get adjusted now post baby and 3-4 years out, and what my body's like now at this stage and age and those types of things. So I think it's awesome to see that when we talk about technique, there's a place for everybody in this office. It's really whole family care. I mean, I think right now, Ava, one of our mamas just had her baby a few weeks ago. And so she's our youngest one, I think, in the practice right now, until one of our new mamas comes in that just delivered this past week, with her baby, then she will be the youngest. And so it really, it starts at the very start of life. And a lot of people ask why, and we talk about that in some of our other workshops. But prenatal care during pregnancy and postnatal care is so important versus waiting till even pediatric care when a baby's born and in this world, because all of that work that mom has to do to support both of them really supports that delivery and that birthing process being as stress-free on both of the baby and mom as possible. There's lots of things with, as long as mom's position is in a great place, that pelvis is then in a better place in alignment, there is less stress upon all the components internally. So the baby has less stress upon it. So we sometimes think about that doesn't have happened until they are exiting and come out. Well, there's stress upon the baby sometimes in utero. And the better we can have mom's position, the better the baby can drop into the positions that they're supposed to be in as they're developing and grow the way they're supposed to, and have less stress upon them even before coming into this world, on this side of the womb, if you will. So it really does start while they're inside mom's belly. And the techniques we do with our pregnant mamas is awesome. And it's so lovely, and it feels so great for them for multiple reasons. But it is, our tables move differently and come up and come down, and we have pregnancy pillows and we still use more instrument, but a lot of their work is light and tonal work, which is really important because they have a lot of hormones that are obviously different in their body at that stage than they ever will have in any other stage of their life. And so when a ligament is really loose because of the relaxin and a lot of the hormones that are higher in a pregnant mom, you have to modify how you're adjusting, because their ligaments actually get laxity in them, and there's not as much we have to worry more about stability, right? Their joints actually move a lot more than they did before the pregnancy or before a hormone change, right? So we have to really think about stability, and that we don't want too much motion in a spine of a pregnant mama, because we don't want to create instability. We want to support position and proper movement, but stability as well. And so Doc and I both have training and have certifications through the ICPA, which is the International Chiropractic Pediatric Association. And, again, work in all those categories, from mom at all phases to babies as well. When we talk about a child or an infant and a newborn's adjustment, for many, many months, there is no tone to them. They haven't developed their musculature yet, right? So many people go, oh my gosh, you're just a brand new baby. And they think about the ridiculous videos they see on like TikTok and stuff. And, there's a part to where that's, I suppose, getting some of what the profession does out there, but I think it's in a really bizarre way, in my opinion. And it's something that is not how everyone gets adjusted. That is not how many people get adjusted, and it's not how babies get adjusted. And so in talking about young ones and their movements, it's all about that brain development for them, and the neurodevelopment does not see a delay or see a kiddo that could end up in more of a spectrum disorder just based on what the neurology is doing and what the brain is doing. And all of that stuff we can start working on well before they show us that in a classroom going into school at 5, 6, 7, 8, to create a healthier brain development earlier on, and supporting them, working through the process that their brain has to go through and the amount it goes through. And I won't get into any of that in this workshop. That's in many of other workshops that you can go watch that we do with kids. And that taps into the point there with polyvagal, but that is really working with kids to adults in any type of trauma that's happened, whether it's a birthing trauma or it's something that's happened through all facets of life. There's lots of tonal work and polyvagal work that is really tapping into that vagus nerve, which is the longest nerve in your nervous system, that we're affecting every time we adjust you at the top of the neck. It is an impulse that is going to change the way your body is perceiving stress and its world. And the stress upon it. So it's really about working at things from the brain. And from that, we're working on better, components all the way through that we just spoke on. But that when we're focused on the start of life, it needs to be much less that happens later in life. And so with the amount of, I guess I would say, pressure we're putting upon a baby when they're getting adjusted, we were just using the analogy the other day, and you'll see it in the office coming up this month as we do some fun things in the office for leading up to our Patient Appreciation Week at the end of the month. But it's about the pressure you would put on a tomato to feel like, is it ripe or not? Right? That's the kind of pressure that is all that's put upon a baby or a child when they're getting checked for that subluxation. Their patterns release so quickly because they're so pure and their nervous system is so young that their body understands exactly what we're doing. And so there isn't, movement that has to happen there in any kind of force or big ways, because that's really just not how the body releases that tension. And it's in many ways, that's how it is for us as adults too. We just have a lot deeper layers of patterns that have been there for decades. So different movements, we tend to respond different to. Touching on this, corrective care is something that, if we're talking about how do we want to maintain a healthy spine and nervous system and brain for life, we've got to be doing things along the way. I was just saying tonight, we have to undo the things that we've either done over periods of time without support, or, creating a spinal hygiene, creating a self-care practice that helps support good curves in our spine and the things we do that take them away. So in our life that we live, and the way in which we do things, whether it's weekend warrior stuff, whether it's sports, whether it's sitting at a desk computer all day, all different types of components change the way, or there's trauma. If there's been trauma like injuries, accidents, concussions, whiplashes, auto collisions, things like that create, whiplash or concussions, those are severe pieces that need to be addressed more at the brain and spinal level, to not become bigger things down the road. And so we really, focus on family and wellness care, but most people find us because there's initially an injury. And then it's about how do we support that so that the intensity of your life is dictated by the support we give it outside of here, inside here and outside of here. Ultimately, that a lot of patients are on wellness care. There's a lot of people that you could talk to in the practice, and they may tell you why they initially came in, but they're not coming in now because they're in pain. They're coming in now because they want to support not being in pain anymore, and they want to support the good movements of their body and being these active, healthy individuals, thriving and doing anything they want to be doing, right? So it's all about overall healthcare. And there's other modalities that we do or that we may support you with, because again, structure and posture is important. If we sleep on a bad mattress or a bad pillow, then we're always going to have low back and neck things that need addressed, because if we're sleeping a good amount of hours in the night, that's 6 to 8, it's a third of your life we're sleeping, right? So we've got to heal. And then if we're not resting in a healthy, healing way, we're not sleeping well. And it's hard to regenerate from that if we don't have good healing processes. Another key component is from the foundation up has to be stable. So if people have arches in their feet that have fallen, it's a really great thing to know that we can support you at an orthotic level with what we do that is custom to you and your body and your structure and your frame, so that you're not undoing the things when you walk out of here that we were just working on correcting. If there's not stability from the ground up, then it's really hard to keep stability in our structure, in our hips and our back and our shoulders and our neck. So those are all components we can support you in getting to that goal and where you want to go. So I want to end with this. There's lots of ways in which we can support, and ultimately we have to look at it. It's as we said in the beginning, pain is really the least of many concerns, because it's just the tip of the iceberg. By the time someone has pain, there is usually a multitude of things that are happening. It's like when you look at this iceberg, I mean, we see the tip of it sticking out of the water when we see glaciers and we see icebergs and we see things in that part of the world. But this is what, an iceberg, this is what that looks like underwater. 90% of it's underwater, right? It's really not, it's really just a portion of it is what we see. And so on this continuum of health to disease, I like to end on this type of slide. And it's really about addressing, where are you? Where are you in your life? What is the focus? What is the concern? Where are we putting our attention to? Because it's really about preserving health, right? And achieving wellness. It takes a different amount of work to be focused there than to be focused in a sense of just not being ill or not having pain, or being more focused on disease rather than health and wellness. And I don't know that I can zoom in on that, but hopefully you guys can see it here on the bigger screen. But it's really, the component of what does that take? What does that take to be really on that wellness focus, right? That, salutogenesis versus pathogenesis, and that, in a sense, concern of disease or focused on disease, that is really things that are about symptoms, about, nakedness, taking any kind of medication, pill, potion to just mask a symptom or a feeling of pain or whatnot. Surgical intervention is key when it's necessary. It's just not always the first thing that's necessary. So how is our body, adapting, and what is it doing? When we're wellness focused, it's really looking on, we want to preserve health. We're talking about, what are we doing outside of the things? How many legs or pillars are under our table, right? Is it like we talked about a few weeks ago in the workshop? Is it that there's a focus on our nutrition? Is there a focus on movement and getting exercise? Is there a focus on learning the components of wellness and what does it take to have a healthy nervous system and minimal stress or interference upon it? So there's multiple things that come into play, and your chiropractic care is one of them. And we'd like to support you in all of those ways. And I think it's a good thing to look at. It's like a teeter-totter. We're moving one direction or the other, right? We're really not stagnant, staying still. It's false to think, like it says, that there's this safety zone. We're either moving towards health or away from health, right? Towards health and wellness or towards illness and disease. And so I hope that in the things you're learning in the workshops, you're learning to lean in to wellness and lean into your healthcare that way, and your self-care and the things that you can do outside of here that support that to really preserve health, right? Because that's what it's about. We really want to have no obvious symptoms. We want to have, consistent choices and consistent things that we're doing, so that it's not the highs and lows, the yo-yoing of ups and downs, and not feeling like we're making headway and progress. So with that, short-term goals are pain management, things like, okay, I get better motion. Oh, that feels good. I move better. Oh, there's less pressure there. Oh, those muscles are less stiff and tight. Those are all great things, but that's a short-term solution. That's a short-term effect, right? We want a long-term effect of health and vitality at all ages. So it's beyond that. So hopefully you've gotten some of that tonight, learned maybe a little different spin on what it is we do here at Monarch and how we're here to support you in your health goals and the big picture from birth to end of life. I want to help send the message out to anybody that's on listening that hasn't been in the office yet this week, or maybe listening or tuning in or got this workshop from a friend who said, hey, this is what they're about. Take a listen and see if you're interested in getting your spine checked. 3 times a year, we open up our office during a full week to all of our open appointment slots for new patients that are referred by our patients and friends and family and community, are seen at our expense. So if there are people, loved ones, family, friends, relatives, neighbors, coworkers, people that that maybe have things that they have ailments that they could talk about or message to you or complain about or share, that it would be, or have kids that have been challenged and that's a struggle in their household. This would be great time to send them in and give them our information. And if we have about 12 to 14 slots, I believe, here on the board for what's happening the week of the 26th. And when those slots are full, they're full. But it is our wanting to give and share chiropractic with our community and your community, that if there's someone that has never been checked, it's an awesome opportunity to come in and have a full evaluation and exam with us. And those scans I was talking about and the x-rays I was referring to, done at our expense to see if there's anything we can do to help and if anything they experience is due to subluxation. So thanks for sharing and being with us tonight, and being engaged in the process and in your process. We're here to support you. So thanks for joining, and we'll see you next Tuesday night. Goodbye for now. Let me see if I can get to.
You know what? The right place. Yeah.
Stop recording. There we go.
Well.